Assalamu alaikum and welcome back to our channel Stars with HK. I'm Humayun Kamran, and in this segment, we spotlight various professionals and organizations who are working and providing services to differently abled individuals. We'll keep bringing you more helpful videos and sessions, so make sure to subscribe our YouTube channel and hit the bell icon as well so that you get the timely notifications against our latest content. In today's session, we have with us Sumaira Hilal from UAE, who's the CEO and founder of Little Birds Speech and ABA Therapy Center. So let's get to know more about her and the setup she is running. Thank you very much, Sumaira Hilal, for joining us, and welcome to our channel.
Thank you so much, Maya, for providing me this platform and this opportunity. And yes, I'm glad to share my experiences and about my setup. So thanks a lot.
Okay. So before diving into your setup and the facility, I would like to request if you can kindly introduce yourself, your education, your experience and expertise, so that our audience feel more comfortable and it's good for them to connect with you as well.
All right. So Maya, basically, I am a professional with having experience of almost a decade. And my expertise includes feeding, speech, and behavior, ABA. I've done my bachelor's in special education. Sorry. And then I pursued a master's in speech and audiology. And then further certifications on feeding from Talk Tools and different IBT trainings. So these are the part of my up till now journey.
So if I can ask, what is this Little Birds, and how you started it, and when you have started it, and where are you located? Some basic information about your setup.
Okay. Thank you for providing this opportunity to just briefly describe about what Little Buds is. Little Buds, basically the aim of opening this Little Bud is to provide help, guidance, and quality service and facility to people out there in UAE. And we are located at the border Sharjah. The building name is Sahabul Emirat, and unit is 3703. So yes, we are there, and we are alhamdulillah catering a quite number of good students over here. That's it.
So if we can ask, what services, as the name itself indicates, something, speech and ABA. So if I can further ask, what services specifically are you providing under this setup?
Okay, so actually it's a baby step we have taken towards this. So we are currently providing speech, feeding, and behavior, or ABA therapy, to kids from 0 to onwards 15.
And what different kind of disabilities or challenges that you are catering for as far as your clients or the kids are concerned? What are those range of different challenges or disabilities that you are dealing here?
All right. So, Humayun, majorly the students coming to us are with the ADHD or autism, and there are speech delays. But yes, we are not limited with ADHD and autism. We cater Downs as well. We cater all learning specific disabilities, because yes, when we are catering the communication, so whoever having the speech or language difficulty, they are welcomed. And yes, the age criteria, as I mentioned before, is from 0 to 15.
So when children are coming to you, parents are coming to you, some are with their diagnosis report as well, and some might be coming without any formal diagnosis. So do you provide or aim to provide diagnosis services within your setup, or you are referring to some already shortlisted professionals for that formal diagnosis to be taken?
Okay, so firstly, I prefer the reports already done, and because that's the main thing we need to have for any planning up the therapy plan, or if you're working for any kind of disability. That's the first rule for me, that you have to have a diagnosis. Other than that, if the child is not with the diagnosis, with the developmental report, so we obviously refer to where the hospitals, there are certain few practitioners, psychologists, developmental psychologists who are doing all this stuff, so we refer to them. And the second part of your question, yes, we aim to have this facility in house as well, so inshallah we plan for the assessments in house as well.
And if we can ask about your working or operational mode, how you work, like some centers provide their main focus is on one-to-one sessions, and some setups are inclusive class type setup where there are different groups sessions as well. So how do you operate?
Okay. So currently we are doing one-on-one sessions with the child. And yes, we aim to have a group setting in future, because once the child is up to that level that he can do a group setting, so we will be having that also, because we are in future, the goal is to have a school readiness program as well, and further opportunities for the facilities for the special needs. So right now, just one-on-one.
Okay. And do you provide also the online services for these speech and ABA sessions?
Yes. For speech, depending upon the client, firstly, what happens is that we um, assess the client, and then we shift the mode from a hybrid or the physical one. And if the patient qualify for an online session, then we opt. But mainly what happens in the online sessions, because parents or the caregivers who are like far away from here, or they cannot manage to come to therapy setting every day or twice a week whatsoever. So then what happens is that we train the parent regarding the therapy services with the online program. That's basically a parental program that's more involved in the parenting and the counseling and the guidance of parents.
Hmm. And if I can ask, do you have some unique feature of your setup that you would like to disclose to us, or you aim that this uniqueness should be in your center in future, whatever?
Okay, so yes, the thing I want to add it to my facility is that what I believe is that we are doing parent-centered kind of therapy program. So when we are developing after assessment, when we're developing the program, it's basically a whole parent-centered as well. That we obviously focus on what parents require, what parents are, and then we guide them according to that, that this is for example of suitable, or this is recommended. And secondly, the thing is that over the time, like in future, I want to have a customization program for the parents, that they can tailor their program according to them, because the parents over here are like aware of what things are. And for it's going to be for those parents who are aware about the needs and about the therapies and the services we are providing. So yeah, it's going to be like this feature I need to add, that is, the parents can customize their program.
Hmm. And what about your team? How you are building that? What specific or what uh, unique thing, or apart from their degrees and experience, what you need to have in your team or the team members?
Okay, so as I always work for the parents, I have I would not say, but empathy and having their perspective as well. This is the first thing which I always put on, that, okay, fine. This is the recommended thing. For example, a child is having this major delay, and he's recommended for this kind of for an example, he is like having almost 5 days a session and all those stuff. So I need to have the understanding of the parents aspect as well. And yes, the other quality for my team building or my professionals will be, it's going to be like having a passion to work, to get results. Because I, it's not like that the degrees are there, fine. But the thing which attracts me is that the passion and the learning for this field. Because Humayun, you see, um, I keep on trying to learn every day for new techniques, for new learnings opportunities, for new researches whatsoever, because our field is growing. And over here and past years, as you have also seen, that it has grown a lot from here to a shift. So
Hmm.
for this, every day there are new techniques, there are new studies, and experimenting with the things. I love to do that. And I would like my team as well to do with the experiments, like with the learning, with the things and all those stuff. So that's the point which I will be having in my team, inshallah.
Right. And currently, is there any addition in your team apart from
Uh,
yourself?
Yeah, we have one specialist who is basically a professional with the behavior IBT technician, IBT therapy certificate as well. So yeah, we have her for students, some of the students who are having those kinds of needs. So it's a
Hmm.
small, but inshallah we'll be expanding it soon.
Inshallah. And what about the cost of the sessions? Because we have heard therapies are quite expensive, especially in the Middle East. When we compare it with Pakistan, even though we feel in Pakistan as well, parents complain that it's quite high therapy charges. But in Middle East, we have heard that even those are quite, the therapy sessions are quite costly as well. So how do you respond to that?
Okay. So first and foremost, Mayo, I would suggest parents, obviously, it's a huge difference, currency difference. So I would suggest parents and myself as well that I don't compare with Pakistan, because you see there's a huge difference. And secondly, with the packages and with the charges, we this is the main one more I would say the thing which we offer to parents is the economical packages for parents so they can afford. Uh, I know there are like many parents out there who cannot go above and beyond regarding the packages, or few of them doesn't have insurance as well over here. So for that aspect, if I see, so yes, the parents need to have a minimal charges, because every slab has to be like have a different kind of charges. So for that, we have a really, I would say, a really economical charge over here for, and we offer 45 to an hour session. So
Hmm.
that's the part which we need, which we have already worked and we are working still.
Okay. And do you allow parents, because parents nowadays are quite demanding about the observation sessions, and so when they demand, so then how do you respond to that demand from the parents? Do you allow that?
Okay. Up till now, yes, I allow, because I put the focus that parents need to know what is going on, how the therapies are going. Morely, it's very transparent with the therapies, whether it's behavior, whether it's speech, whether feeding. So I have the parent inside my room, and they can observe, and the home plans and the home assignments are also given and discussed. And yeah, it's both the team working together.
Hmm. And do you feel that the issue that we are facing in Pakistan and most of the cities in Pakistan, lack of awareness and use of such terms which are obsolete in most of the developed countries, like abnormal child or something like that. We have uh, pretty decent words like neurodivergent and differently abled. And I have heard in UAE people of determination. So, do you feel that this dignified language is issue over there as well? And secondly, do you think that such wordings or phrases can damage the psyche of both the child and the parents as well?
Actually, yeah, the words, it's not about only special needs we are saying or we are catering special needs. The words really do matter for any human. If you are praising, if you are putting any comment, they are okay. So over here in UAE, it's not the special need or it's the student of determination. And over here, I would say it's not about the child because child is naive, he's innocent, he doesn't know what's that. But the parent, being an adult, we know what special need, what ADHD, what autism, or what sort of like labelings are there. So what I keep in, for me, I keep the label aside of my mind and I target the child first, whether he's
Hmm.
autistic, whether he's ADHD, whether he's like intellectually delayed. uh, I put the child first. Okay, fine, this is the thing, this is the quality, these are the strengths, on these are the weaknesses, we need to work on that, that's it.
Hmm. Right. And you have been working in Pakistan as well, and you have moved to UAE now and working there as well. So, what's the difference and the environment of the professionals in Pakistan and in UAE? How you compare that? What's the positive side of uh, professional environment in Pakistan as compared to UAE?
Okay. Humayun, actually, you can say I would say I was fortunate enough that I have good people around me in Pakistan as well. Well, when back I was serving the academy, the Iqra University project. I have a good mentors. I have a good team, and I had really good people who really who really was passionate about all this learning, working, and our students were our strength. And in Lums as well, when I was serving there, so that was a good experience. Moving to UAE and there's not much cultural shift, but yes, the ethical part of the professionalism or of the work environment is a great difference over here. Ethics
Okay.
usually in Pak, there is a lesser work ethics, but over here they are catered to an extent, and that's the difference. That's the difference over here.
Oh, very nice point. And at the last and last question, and then we'll try to wrap it up. What advice you can give to parents when they are searching for a good center or a professional? What points they should focus? How they can get to a good place for their children?
Okay, so you see, what I do for my setup, and I would recommend the parents as well that if I am like looking for a therapy setup, I would definitely look for the therapist credentials, how well equipped the setup and specifically the therapist is, how involved, and how is the transparency. Because I believe that parents need to know how the things are working, and um, we should make, if they don't understand as well, we should make them understand that this is the thing which your child is having, this is the struggle which he's having or she is having, so we need to work this aspect or this way. And don't go on the, I know I know parents are struggling with the financial burden as well, but you should look into the aspect that how well the therapist is. Obviously, if the setup and the therapist is equipped and qualified, then he would have a slight different charges according to their qualification and according to their setup and the market. Don't settle for less. Don't settle for less. It's gonna be like I would say it's take a lot of time. There's a difference between a professional working and the outcomes, and there's a difference between just a few trainings and workshop and working professional. So yeah, this is the difference.
And lastly, you have done IBT training as well. I have recently came across a post and your feedback as well for the trainer. So Alia Yasser. So when are you planning for the exam as well? It's in the pipeline?
Yes, I am under supervision and I am planning. Actually, it's a very, very, I would say, new and a good journey with Ma'am Alia. And again, I'm blessed to have one of the good mentor in my list again. And yes, the exam is due in September, and hopefully I'll get through that. And still, I am in, like under supervision with her, and inshallah, I hope I get through that as well.
Inshallah, our prayers are with you as well. So with that, we are at the end of our session. I would like to thank you once again for your time and support, and I hope this information will be helpful for people who are looking for such information around your area. So thank you very much once again.
Thank you, Maya. It was so nice having a talk with you.
Right. Thank you, Ji. And thank you everyone as well who are watching this video. Inshallah, we'll meet next session with a new guest or topic. Until then, take care and Allah Hafiz.